very vital for the patient's safety, as well as the pharmacodynamics also help the dentist to understand the efficacy and safety of the medications. And both properties and characters of pharmacokinetics and dynamics will have for you to have an ability to predict a lot of the diseases that you might encounter when you become a dentist afterwards. So basically, when you have the medication in your hands, something that you have to keep in mind as a prescriber is to do these 5 rights. Right patients, right drugs, right dose, right routes, as well as right time to administer the medications. And for the sake of the standard that we practice in the hospital, you need to document all of those things all together from the right number 1 through 5, through the right number 5. So that means that you did something towards the patients. And how to figure or consider the right patient, right drug, right dose, and right route at right times. We use the principle of pharmacokinetics and pharmacodynamics to help us understand how do we do the right things to the patients. And here is the kind of like a busy and complicated slides about the pharmacokinetics and pharmacodynamics and how those 2 terms connected to each other. All right, so I'm going to go slow just a little bit to make sure that you understand the whole pictures of these 2 terms. Pharmacokinetics. If you take a look on the left-hand side of this picture from this body in the blue sheets, you will see that the pharmacokinetics are the properties that the medication do something into the body. Basically, if you take the medication by this pill, and then in this blue picture, the medication will go through all of this process. For example, the medication needs to get absorbed into the body, distributed into the body, and some of the medication, and a lot of the medication usually require the drug metabolism in order to convert it into the active form or to eliminate it from the body. And there is so many routes of the drug metabolism and transportation of the medication in the body. And then after the medication get into the circulations, those circulation will bring the medication spread into the body, whether it can be spread into your brain, your teeth, your skin, or any other site that the medication can distribute it to. And this is very important. The properties of the medication that can distribute it into the body we call the volume of distribution. And we're going to talk about this a little bit more. And why this is important? Because if you have some disease, if you have a patient who comes to your clinic with a toothache, and if the medication cannot distribute it and locate it at the site of the disease, how come that medication can be effective? So this is very important, and the pharmacokinetics of the medication can play roles. And after the medication distributed into the bodies, some of the amount of the medication can go through a lot of the organs, including in the liver and in the renals. And those kind of organs are very important to excrete the amount of the medications. And if you administer the medication just one time and you don't repeat the dose, the medication will be cleared from the body within the hours of the half-life of the medication, which means that the lifetime of the medication that can stay in the body. And then after they've cleared out of the body, if you check the blood level of those medication, you will get a zero amount of that medication, which is usually a very normal concept of the medication when it gets into the body and it has to be cleared. And on the other side, with the orange picture, the pharmacodynamics of the medications. It means that when you get the medication into the body and it is already in your circulation or in your blood, the medication will go to your site of the disease. Then the medication will bind to something into your body. For example, in the receptor, bind to the enzyme, and those enzymes or those receptors will interact with the medications and leads to the action that change when the medication binds into the receptors. So all the cascade and all of the binding from the receptor and the medications can change a lot of things into your body, and it depends on the medications. For example, if you are taking some blood pressure medications, those medications can get into the blood and then bind to the receptor in the vessel in your body. And then those vessels will have some constriction or dilation. It depends on the type of the medications. And that creates the lower blood pressure. So those are the concept of pharmacokinetics, that how the medication interacts with the receptor or the type of receptor in the body, and then change the physiological functions in the body. So there are very close connection between the pharmacokinetics and pharmacodynamics. The first step, you need to have a great pharmacokinetic first, so that you have a very great number of the medication in the blood, so that the medication can get into the site of action, so that you can have some change or that you can see some efficacy of the medication by these terms. However, there's a lot of factors that can be associated with the prediction of the pharmacokinetics and pharmacodynamics of the medication that you administer or prescribe to patients, and we are going to talk more about that. And this is another example of what I am trying